Buoy Health Insights, Projectile Vomiting. Hello, and welcome to Buoy Health Insights. Today, we'll be exploring the unpleasantries of projectile vomiting and what can cause it. Projectile vomiting is particularly startling, as it is highly forceful vomiting where the contents are expelled several feet away from you, and it's difficult to control. Remember, it's essential to stay hydrated, especially when dealing with such a symptom. Let's delve into some potential causes of projectile vomiting and the other symptoms you might experience, which could point to one of these causes. Food poisoning. This irritation of the digestive tract can lead to projectile vomiting along with fever, watery or bloody diarrhea, nausea, and stomach cramps. It typically emerges several hours to 2 days after consuming contaminated food or drink. Signs of dehydration such as extreme thirst, dry mouth, infrequent urination, and dizziness are also risks associated with food poisoning. If you're unable to keep food or fluids down, or if your symptoms linger beyond a couple of days, reach out to your doctor. Gastroenteritis, often misleadingly referred to as the stomach flu. Gastroenteritis is inflammation of the stomach and intestines, usually caused by viruses or bacteria like norovirus, rotavirus, and adenovirus. Symptoms include nausea, chills, exhaustion, and fever. If symptoms persist beyond a day or two, or you can't maintain hydration, medical intervention may become necessary. Migraine, projectile vomiting, accompanying an intense and potentially debilitating headache, highlights the presence of a migraine. This comes with light and sound sensitivity. If your migraine symptoms are worsening or differ from typical patterns, or you can't keep down food or fluids, consult your doctor. Treatment may include over-the-counter pain relievers or prescribed medication. Pregnancy. In pregnant women, especially in the first trimester, morning sickness can cause nausea and vomiting. This condition may escalate to hyperemesis gravidarum, which includes excessive vomiting and is a more severe condition potentially leading to dehydration, weight loss, and preterm labor, requiring medical treatment. If projectile vomiting occurs in infants and children, watch out for signs of dehydration and consult your pediatrician, as children can become dehydrated quickly. However, projectile vomiting can also be indicative of other, rarer conditions such as obstructions in the stomach or intestines or significant head injuries. In infants under 6 months, severe projectile vomiting can be caused by pyloric stenosis, a narrowing in the lower portion of the stomach. This narrowing makes it difficult for food to leave the stomach. Surgery is needed to treat pyloric stenosis. When to seek medical care. If you're sick for more than a day or two, can't stay hydrated, experience severe abdominal pain, or have a persistent fever, it's critical to call your doctor. Projectile vomiting is undoubtedly distressful, but knowing when to seek help can make all the difference. Remember to stay hydrated and seek medical attention if symptoms persist or worsen. And that wraps up today's session on Buoy Health Insights. If you found this video helpful, please give it a like and don't forget to subscribe for more health insights. Stay healthy and informed!